Welcome back to MLT 120. Today we're going to talk about the erythrocyte sedimentation rate, and we usually just refer to it as the ESR test. So what would be the purpose of the ESR test? It is used to detect and monitor inflammatory disease. So examples of some diseases and conditions that would cause increased ESR would include things like rheumatoid arthritis, certain malignancies, multiple myeloma, infections, myocardial infarctions, pregnancy, or just overall older age. So here's just a question. Does the ESR diagnose any specific disease? You can look in your book on page 167, but I'll go ahead and give you the answer. No, it does not. It is more of a screening for inflammation in the body. It's not going to diagnose particularly one of these conditions listed. It's just going to let us know that there is inflammation in the body somewhere. So let's talk about the principle behind the ESR test. So the way the ESR test is set up is it's the rate in which your red blood cells will fall in millimeters per hour, and it's in an anticoagulated blood specimen, and we allow it to stand at room temperature for a period of time, and we usually let it stand at room temperature for an hour. And you can look on page 167 in your textbook so you can see the image of what we're talking about. But the red blood cells normally have a net negative charge, and they tend to repel one another. However, normally over time, the red blood cells will settle slowly and they will stack in what we refer to as a rouleau pattern. And that's what's over here. So you have your normal erythrocytes, or your normal red blood cell, and this is the side view of the little biconcave disc shape. And when they stack together, we kind of also refer to this as a kind of a stack of coins, and that's known as rouleau. But where there's a case where there's increased plasma proteins, those plasma proteins are positively charged, and they will counteract the red blood cells' negative charge. So they will make the red blood cells come closer together and thus stack and fall more quickly. So we will see an increase in acute phase proteins in inflammatory diseases. So we'll have an increased ESR reading in patients with inflammation. In patients where their plasma, fibrinogen, and globulins are affected, it can also affect the ESR reading. So our specimen for this test is an EDTA tube that's well mixed. We want our samples at room temperature, and we want to test them within 4 hours. If we cannot test them within 4 hours, we're going to store them in a refrigerator at least 4 degrees Celsius, and they can be stored for up to 24 hours. And we always want to return our tubes to room temperature before testing, because the temperature of the tube or the sample can affect our ESR result. Factors that can affect the ESR test or result are listed below, and we're going to talk about each one of these in a little bit more detail on the slides that are coming up. But the main things are the red blood cells themselves, plasma, mechanical and technical errors, and also age and gender of the patient. So let's first talk about how the red blood cells themselves can affect the ESR results. The size of the red blood cells, whether they're macrocytic or microcytic, can affect whether it's an increased or decreased ESR reading. The shape of the red blood cells. Abnormally shaped red blood cells can decrease the ESR because of interference with rouleau. Maybe they're not going to let the rouleau or the red blood cells stack properly in the rouleau pattern. Also, patients with severe anemia, their ESR result will be greatly affected, because patients with severe anemia, their ESR is of little value because the test will be increased due to increased plasma and lower number of red blood cells. How can our plasma affect our ESR results? Our acute phase plasma proteins are produced by the body when there's inflammation, causing our ESR to increase. Our acute phase protein examples include when there's acute tissue damage, if someone is pregnant, if there's chronic inflammation, or if there's chronic infection. Also, we mentioned earlier that proteins in the plasma, such as fibrinogen and gamma globulins, can cause an increase in our ESR. What mechanical and technical factors can affect our ESR results? First off, temperature. We've already mentioned this. An increase in temperature causes an increase in our ESR. A decrease in temperature causes a decrease in our ESR. That's why we must bring up our temperatures to room temperature if we have refrigerated our samples. Tilting. If we tilt our tubes, it can cause false readings or increased reading. So tubes must be vertical with no tilt. Increase, like I said, will increase the ESR result. Also, we must be conscious of vibrations. Vibrations will cause an increase in our ESR readings. So do not perform ESRs near a centrifuge that's in operation or on the same countertop, because the vibrations from that centrifuge can cause your red blood cells to drop more than they normally would, which would increase your ESR reading. Bubbles in the ESR column can cause a decreased ESR, meaning they don't let the red blood cells drop down as much as they normally would. They're going to hold those red blood cells up, those air bubbles inside the tube. So that is another mechanical technical error. This next slide is also mechanical technical factors that can affect ESR. Clotted specimens can cause a false decrease. Old specimens can cause a false decrease. Again, we must test our samples within 4 hours, and we want them at room temperature. If they cannot be ran within 4 hours, you need to refrigerate them, and if you refrigerate them, you must bring them up to room temperature before you test them. You have to be careful about the amount of anticoagulant you use. You don't want to use too much, or it can cause smearing of your red blood cells or cause your red blood cells to become rounded. You want them to keep that nice biconcave dish shape so they can form rouleau and stack correctly. If they have too much anticoagulant, it can cause a false decrease. Also, you do not want to use anticoagulants of oxalate of heparin, because that will cause the red blood cells to shrink and will falsely increase your ESR. So don't use too much anticoagulant, and don't use the incorrect type of anticoagulant. So gender and age, how does that affect our ESR results? Our ESR tends to increase with age. Women have slightly a higher ESR than men. Our normal values for males less than age 50 is 0 to 15 millimeters per hour, and females less than 50 years of age is 0 to 20 millimeters per hour. There's some different testing methodologies for ESR. There's both manual and automated methods. For ESR, we're going to learn the manual and the automated test in lab. We're going to start out with the manual method. The most common method used today is the modified Westergren ESR test. There was an older method just called the Westergren method, and it used citrate as a liquid-based anticoagulant, and it resulted in dilution of blood, which caused inaccuracies in the ESR. So most times people's going to use the modified method now, and that's the method that we're going to use, where we use the EDTA in place of the citrate as a anticoagulant. Here's some images of the different methodologies for ESR testing. This top image up here shows you the manual method. We're going to take our patient samples from our EDTA tubes, and we're going to put them in these tall, thin, skinny tubes, and we're going to let it drop the blood drop for an hour, and then we're going to measure how the blood dropped, how far it dropped over an hour, and that's going to give us our ESR reading. The automatic method, we have this instrument right here. We're going to eventually learn how to operate it. These little tubes right here are going to be filled up, and you can put them in the well, and then the instrument or the analyzer is going to read it for you. A lot of the hospitals has gone to this analyzer for the ESR test. This is called the mini cube, and you do not have to transfer from the EDTA tube into another tube like with the manual method or this analyzer. You can put the EDTA tube straight into the mini cube, and it will do an ESR reading for you from the EDTA tube. One last thing I want to mention is as far as time for this test. Remember, our manual ESR test takes about an hour to run, but with these automated methods, it only takes about 20 minutes for these analyzers to run an ESR test. So that's kind of an advantage. But I do want to mention that several of our doctors' offices in our local community and area still use the manual method to do their ESR testing. This concludes our lecture on ESR testing and the ESR testing method. We will be completing the ESR testing method in lab, and I will see you over in the next lecture.